overreact. So all of a sudden, we've got a harmless substance that triggers an unwanted response. Um, so, from a standpoint of symptoms, typically we break down the allergy reaction into two main phases. The first is the immediate one, and most of us are familiar with the sneezing, itchy, watery eyes. Suddenly, you just have to leave the premises and find a Kleenex so that you can kind of move away from what the physical reaction is. And oftentimes that'll subside, and then suddenly later on during the day, overnight, it's the other. And sometimes this can be the more miserable type of symptoms. So congestion and swelling, suddenly you can't breathe through your nose. Some of the mucus, whether it's watery or thick, there's different consistencies of that. Fatigue, a lot of fatigue. You just feel really tired and you're wondering, am I sick? Did I not drink or did I not sleep well enough? Do I need an extra cup of coffee? I'm just very tired. And then, of course, sensitivity. So once you're kind of into this, I don't feel very good. Things like sometimes people wearing too much perfume or a cleaning agent or even secondhand smoke, suddenly you seem much more sensitive and it makes things even more miserable. It's not just the respiratory tract that gets affected by this. So it's literally can be the whole system. And so we'll kind of go through some of these circles. So we all kind of know the person that has the wheezing or the chest tightness. They're looking for their inhaler to give them relief. The eyes, the red, itchy eyes. Sometimes it's even swollen eyes. Skin can be very involved. We all know the poison ivy reaction, right? You get one little splotch of poison ivy oil and suddenly your whole body has a reaction. The runny stuffy nose that we talked about, fever, it's not as common, but can happen, especially if your body's having a pretty significant systemic response. You can feel a little feverish. Sore throat, that's always associated with the drippiness that's coming from the nose, but people can also just complain about a scratchy throat, like there's itching in there. Swollen lips, tongue, face, eyes. We'll see this a lot more often with the food allergies than we will just with environmental air allergens. Headache, very common. Cough, kind of matches the wheezing. And then the stomach pain. It can be associated with just food sensitivities and food allergies, but I'll also see this with seasonal allergies as well, like the queasy stomach. This is not a complete list without mentioning anaphylaxis, and that is the big reaction. We all kind of know it when people have really bad seafood allergies, where suddenly they're just swollen shut. They can't breathe. They start turning blue. They're looking for the EpiPen. But yeah, and we'll see that a lot with multiple insect stings, like people who get stung with 5, 10, 15, 20 wasp. Stings and that kind of thing. And anaphylaxis is completely a life-altering, urgent, systemic reaction. You need an EpiPen and you need direct hospital evaluation. Breaking it down to the common allergy subcategories, the airborne ones, the tree pollen, dust mites, pet dander, skin, that's more of the contact reaction. So nickel, we always think about like cheaper jewelry, latex, cleaners, cosmetics, sometimes the lotions that we use, food, which is going to kind of phase out of today's conversation because I don't get too far into the GI tract. I'm ear, nose, and throat. But the food, you'll see tree nuts, milk, eggs, those sorts of things. And then medications. And medications, the most common ones, penicillin, sulfa allergies to certain antibiotics. Some patients are allergic to ibuprofen. And then some of the bigger medications like anticonvulsants, chemotherapies, those sorts of things. Seasonal allergies, we have delightful 4 seasonal allergies in Buffalo, New York, and we got a robust season. And it's been surprising how bad spring was and how fall hasn't been quite as bad. But last year, it was the fall that was so bad. And no doubt, being a Buffalonian, this is one of our challenges. In the spring, it really is dictated by trees. And this year, we had cottonwood in the South Towns. That was fun. Summer, we're definitely seeing grass. This year was mainly June and July. And then right now we're seeing ragweed, and we just haven't seen much rain. I mean, it's been escalating over and over again. I'm not sure what this weekend will bring, but I know last week we had a lot of ragweed. And then the winter, we're indoors. So dust and mold are really tough. And those are definitely things that we will often see in the ENT world where it's like, this may not be infection. This could be allergies. All right, so then we get to diagnosis. How do we know if we have allergies? So, medical history, there are a lot of questions. I think, yep, we'll get to the long list of questions, but things that really make and break a doctor or a provider visit when it comes to allergies is there's a lot of detail. You guys live with these symptoms every day for whether it's short periods of time or long periods of time. And the input that you give us with symptoms is really, really helpful. So, you being the patient and us gathering information is probably the most critical part of establishing this. Physical exam, of course, we have to look. I mean, otherwise we'd all be doing telemedicine, right? We don't do everything over the Zoom and over phone calls. But the physical exam is really, really important. And then once we've sort of assessed all of that, appropriate testing. And the cute little boxes down here show you a little bit of the skin prick testing. In vitro is blood work. We call it in vitro. And then the spirometry is talking about lung testing. All right, so let's get to the medical history. Things to think about before you come into the office. I need to go see a doctor. I want to know if this is allergies or not. What should I bring in? Bring in a list. Bring in a list of all your complaints. So frequency of symptoms. I sneeze every morning for the first hour of the day and I blow my nose. Those are really important details. Is it an everyday thing? Is it a weekly thing? Is it a monthly thing? Every spring I get this. Are there things in environment that I'm suspicious of? Oh, I did gardening all day yesterday, or I cleaned up the leaves for the last 3 days. Am I symptomatic now? Super, super helpful. Pets, dogs, certain, like I always love the Christmas story. I don't have allergies, but when I take all the Christmas decorations out from the basement, I put them up. I'm miserable for the month of December. That's suspicious. Associated symptoms. So going back to that list of headache, congestion, stuffiness, I don't sleep well, or I can't feel like I'm waking up well rested. Those sorts of associated symptoms. Medications. Guess what? The over-the-counter medication options are limitless. And it's really helpful for us to know as providers, what have you picked up? And if you don't know the name, take a picture of it, write it down. I'm always interested to see about sprays, saline spray, decongestant spray. Have you tried nasal irrigation? Have you tried to do the irrigation pot? Those kinds of things can be really helpful. Decongestant pills, allergy pills, all those other kinds of things. And then if you can bring in a list of all your antibiotics, maybe some steroids, inhalers, all of that can be really, really helpful. I'm sorry to interrupt, Mark. Do we know why all these boxes are showing up on my slide right now?
I don't.
Okay. If you're Sam, I would love for you to stop the boxes. Okay. Going on to the next part. Sorry about that interruption. Alleviating and exacerbating factors. Yes. Things that may have helped, things that didn't help, things that weren't helpful. Really good to know. And then the past medical history. And usually we can gather some of that from an old medical record if your primary care sent it over. But if you've had allergy testing even 5, 10, 15 years ago, bring it in. Super, super helpful. Things do change over the course of time. But asthma, childhood or adult asthma, ear tubes, how many sets of ear tubes? Did you have food allergies as a kid? Were you milk sensitive? Any big swelling, angioedema? Have you been prescribed an EpiPen and why? Rashes and eczema. All right. And then some of the other more mundane things about home, work, and school. Obviously, you don't need to write down notes about that. Pets, previous cats. Did you know if your apartment had a cat before you came in? Those sorts of things. And then social. You'll be surprised. Being exposed to young kids can be a factor with all of this. If you're a caretaker for kids, if you have the kids for, 2 months out of the summer, those sorts of things. Yeah, if you're actively smoking or past smoking, and yes, I have to include marijuana, THC, all that kind of stuff. And then, of course, alcohol. And those are typical questions that we'll ask. Why is the medical history so important? This is a really kind of busy slide, but it is important for accurate diagnosis. And so typically we'll take your symptoms, we'll take your story, and we'll start incorporating that into where we're going to head. Obviously, everyone is different. Symptoms can vary greatly from patient to patient. And then part of the evaluation is, If they have really bad asthma, we may need to evaluate them like this. Or if they don't have asthma, but their skin is really sensitive to rashes and those sorts of things, that will help us sort of gear evaluation into a different direction. So just know that the cause, the effect, putting the story together, that's why we're kind of sitting there staring at you going, what's next? What's the next question? Those sorts of things. All right. Family history. We're starting to learn more and more about the genetics when it comes to allergies. So siblings, parents, if you can remember things, but asthma, eczema, um, urticaria is like an itchy skin sort of thing, angioedema in the family, food allergies, those sorts of things. Did you have a sibling that needed allergy shots for a few years? Those sorts of things. And they can be really helpful to help guide us. All right, so let's talk about physical exam. This is always fun. What brings you in? What do you have? And when you're actively symptomatic, these are very obvious things that we can see. So just looking at the eyes. So you'll see this blue discoloration under the eyes. And some people also have a little bit more of the bags under the eyes. Obviously, this is a very youthful set of eyes. This is a kid, but it's got the allergy shiner. So it typically is a little bit more blue, but it shows us venous congestion. It typically matches what's going on in the nose, which is not a happy place. There's another phenomenon that we'll sometimes see under the eyes called Denny's lines. They almost look like linear lines, and they can sometimes be present after the initial swelling of the eye starts going down. Tearing, we all know the bloodshot, icky, sticky eyes, especially in the midst of an acute reaction of sneezing, of watery eyes, and your eyes will often look like this. Ears, you'll be surprised at how much ears can be a part of the allergy reaction. It's interesting because I've been seeing a fair amount of ear symptoms when we have a combination of seasonal allergies and then the forest fire smoke. We saw that in June 2 years ago. I saw it in August. The ears just feel stuffy. And what I'm showing you here is an eardrum that's a little retracted. And the patient will tell me, it feels full. It's muddled, cotton ball in my ear. It just feels like cloudy hearing. The back of the throat, you might see this pharyngeal cobblestoning. I like to always tell my patients what I'm seeing when I'm sticking the delightful tongue depressor in the mouth. But that's what we'll often see with allergies, and we'll also often see some drainage with it. You'll be surprised, but in the nose, there's a whole lot of things that we see. We stick that cute little nasal speculum, we dilate the nostril, and we look in there, and usually there's some very telling signs that let us know, oh yeah, this is rip-roaring allergies, or this might not be allergies. This might be something different. The voice, very involved with a lot of the drainage and the congestion. As we mentioned, the skin. And then I think underneath my cute little thing, it says stomach, but GI tract, we'll see symptoms like that. Obviously, we can't see the stomach in the office setting. All right, so now we're going to move on to testing. From a standpoint of testing, there's usually two main techniques that we use for testing for allergies. We'll talk about the blood testing first because this is just the most direct way. We have you sit down, we stick the needle in the arm, we evacuate 1 or 2 vials of blood, and then we take it and send it off to the lab for them to evaluate. And what we're looking for are particular blood proteins circulating in the blood. And you don't have to be having an active reaction or active allergies to find out if you're allergic. It does take a few days. It's very, very specific. And you either have the protein markers or you don't. You can be on allergy medications when you get blood work. It can be very convenient. We don't have to interrupt the medical management you have going on. You can even be sick and get this testing done. It is expensive if you have to pay out of pocket. Typically, it's covered to some degree with your insurances. Insurances seem to be a little bit more varied in what they do and don't cover. And then, of course, high deductible. Always have to look into that. And it's very, very useful if you can't do skin prick testing. So let's talk about skin prick testing. So this is the typical, oh yeah. And there are a few different ways that you can skin prick test. The most common are a very shallow, like it literally just pricks the skin. You're not sticking a needle underneath the skin, but you're just pricking it. And what you're doing is you're putting just a little bit of test solution on the skin to see if you make a reaction. And one of the little spots is always what we call control. So you have to have a reaction at that spot for this to be a valid test. So there's one sort of test that's going to react that may not be an allergy. And then there are typically a series of other things that we're testing for. And that's where the history is so important. If you have a lot of cat exposure and you're symptomatic around cats, we're going to test you for cats. If your symptoms are more obvious in the spring, we'll be testing you for trees. And with trees, it's a number of trees that we'll be testing you for. In the fall, more mold, mugwort, ragweed, those sorts of things that are around here. And then in the summer, there's 2 or 3 grasses that we'll test for. But again, your history will help direct us on which things to test for and what to kind of test into further detail. We could spend a whole lecture on just the type of things that we can test for. It does cause some itching. So that's probably one of the things that is sort of not necessarily uncomfortable, but not wanted. There is some anti-itching cream. There is some medication we can do after the testing to make that better. The thing is that before you come in for this specific, it's less expensive. Let me caveat that. That's usually less expensive from the insurance standpoint. The problem with skin prick testing is we have to stop your allergy management. So you can still do your inhaler, you can still do your nasal steroid spray, but you can't do your allergy pills. You got to stop them 5 to 7 days beforehand. You can't do Benadryl. Well, we've got some other very specific medications that you can't be on. So when you come in for evaluation, bringing a whole list of everything that you take will be helpful to make sure that we make for the most accurate of testing. And what you'll notice is highly sensitive is that skin prick testing is really, really good. And it really helps us to determine if you're allergic, how allergic you are, where to go next, and then to give you a pretty fair assessment of what we think you might benefit from treatment-wise. All right, so one other test that we probably will not ever offer here at Western New York ENT is pulmonary testing. And the lungs are heavily involved with allergies. So we will be screening, we will be asking, we'll inquire about when your last asthma attack was, but all of these things. But asthma is so directly correlated and lung function is so directly correlated with nose and symptoms of the nose that it will be asked about. It will be part of the discussion. And just know that there's a lot of things that will overlap with the allergist and the pulmonologist or the lung doctor. All right, so management and treatment. Number one, if you can avoid the trigger, everyone's going to tell you if you've got a really bad cat allergy, well, don't get a pet cat. Don't go to the friend's house that has lots of cats. And if you pet the cat, make sure you wash your hands before you touch your eyes or your nose. So avoiding things. When it comes to like contact dermatitis or certain like nickel allergy, we'll tell you, don't get the cheaper jewelry, avoid certain lotions, but there are really good benefits to trying to avoid your body from going into the trigger. Medications, back to the shelves and rows of options that you go and see when you go to your pharmacy or Walmart or any sort of store. It's pretty impressive how much stuff Tops and Wegmans has in their shelves nowadays. We can break it down to 4 big categories, and we'll start with the alternative homeopathic options first. So saline spray, hypertonic saline spray, some of these non-medication options, and they can be very effective for the right person at the right time. And so again, bringing things that you've tried beforehand and then understand that there will be some things that we typically will suggest or recommend as part of the maintenance. We'll go up to the eye drops. The eyes are an entry gateway for all kinds of allergens. So moisturizing drops, artificial tears. There are allergy eye drops, the older fashioned ones and the newer fashioned ones. The old ones always sting and burn, really effective, but uncomfortable. And then the newer ones that are a little nicer, like Pat-a-Day. So nasal steroid sprays, you have definitely seen a big transition from what used to be only prescription to now over the counter. And these are really, really, really good options. And some are better than others. Some are well tolerated than others when it comes to drying, smells, the delivery system. There's a number of different ones. And there are still some that are prescription that are fancier, and then a lot of them that are over the counter. And again, those are all things that, depending on your nasal exam, is this the right fit for me? We almost all know the antihistamines, right? It used to be just good old Benadryl, and then we start getting Claritin, we start getting Claritin D and Zyrtec D. Allegra, and now we've got Zizal, right? So we've gotten a lot of options. Now, you'll notice all the ones that have the decongestant, so the antihistamines or the allergy pills with the decongestant, so Sudafed, right? Pseudoephedrine. You'll notice that those are all now behind the counter at the pharmacy. And pseudoephedrine, unfortunately, is the ingredient that they use to make meth. Well, the entire U.S. Pharmaceutical kind of got, sort of um, savvy and took an over-the-counter medication and put it behind the counter so that we can monitor how much people purchase. It takes a lot to make meth, but that's one of the deterrents now by, trying to get the decongestant. Next, immunotherapy. So immunotherapy is when we train the body to stop making as much inflammation. And what we're doing is we're training the body in very minimal quantities to say, okay, here's a little bit more. And by doing that gradually, we're muting the body's response to how aggressively it wants to respond to it. And from a standpoint, it's almost training, and it has to be a linear, progressive, uninterrupted passage for it to be successful. Shots are the most common one. We've been doing allergy shots for decades. It's time consuming every week for a few months, and then you graduate to monthly, and you're typically looking at allergy shots for 3 to 5 years. It really does take that long. And depending on how many allergies, right? If you've got 2 or 3 allergies that you need a shot for, okay. If you have 4, 6, or even 8 allergens, I think it's 4 per each arm that we typically start restricting, but that's a lot, and it can take a while, and some people will take longer to get better depending on their reaction. Sublingual tablets. It's prescription. It's very convenient, and there are only 3 that we have available in the US, but these are FDA approved products that you stick a tablet underneath the tongue once a day. Wow, no doctor's appointments. You can give it to yourself. And the 3 that we have right now are for grass, called Grass Tech. Another one called Ragatech for ragweed. And then for dust mites, we have Odactra. And what we notice with these is they're convenient. People can be very compliant. And after taking every day for either the season for Ragatech and Grass Tech, or for daily for 3 years for the dust mite one, that it's really effective. Some insurances are readily accepting that and some aren't, but that is definitely one of the options that is always going to be discussed if that fits your testing, it fits your symptoms, and it's something that you're interested in doing. All right, and then sublingual drops. And it's kind of like the tablets, but it's a liquid, and we can do all the other ones. So some of the trees, some of the pets, especially like cat dander. And what these are these drops that you put underneath the tongue. You let them sit there for about 2 to 3 minutes, and then you can spit it out. It's not FDA approved, but they've been doing it in Europe for many, many years, and it can be very, very effective. The unfortunate thing is it's going to be an out-of-pocket cost, but things to consider, right? Like, what as a patient can I think about doing? And so cost, benefit, convenience, and what am I looking for relief-wise? With any of these treatments of immunotherapy, you're going to get an EpiPen. And then sometimes after a allergy testing, if you have a significant response, we might even just say, hey, you probably should be walking around with an EpiPen just because your reaction was so severe. All right. Let's talk about what happens if you don't do things. And this is not a doom and gloom slide, but it should make you aware that allergies aren't just, oh, you have allergies, no big deal. Allergies can be very consuming of your quality of life, of your energy level, and how it can affect the rest of you. Daytime fatigue and drowsiness. During your allergy season, you feel tired. You just almost feel like you need an extra cup of coffee, especially if you're not taking medications or things to make things better. Dental issues. I'll see this a lot. Patients just have been mouth breathing around their allergies for years. They have dry mouth. They have icky, sticky stuff on the tongue. Sorry, I'm using such medical jargon tonight, but a dry mouth, not feeling very good. Chronic bad breath. I'll sometimes see that. Cavities, see that in kids or adults, but things that we can sometimes see with chronic nasal obstruction, chronic sinus infections. Allergies don't cause sinus infections. And I'll just repeat that one more time, but allergies don't cause sinus infections, but they create a beautiful environment for bacteria and a viral infection to do their little party. And before too long, it can lead to an infection. I definitely will see this in some of my patients who have known ragweed allergies. And it's almost like this time of year is a little tough. They don't feel so good. They're starting to be run down. They forgot to take their allergy medications for 2 or 3 weeks. And darn it, didn't they get the viral infection that was going around the office or that their kid brought home? And suddenly, within 3, 4, 5 days, not only are they like stuffy and yucky and viral, but like whop bam boom, right? Sinus pain, pressure, drainage, cough, even a low grade fever. And at that point, you're like, oh, I might have a sinus infection. So I think that's one of the contributing factors of being a Buffalonian during our ragweed season, that you can kind of predispose to that sort of inflammation. Asthma flare-ups, we will definitely see patients with poorly controlled asthma that is exacerbated when the nose is unhappy. Ear infections, we talked about eustachian tubes being plugged up with unnecessary allergy inflammation. It can lead to ear infections, plugged up hearing, that kind of thing. And then when we've looked at over the years quality of life, and we've done a lot more into this type of research and data just to sort of help quantify not only to the doctor, but to the patient as well as the insurance. Why is it so important that we do this? Well, it can have a direct impact on your quality of work, performance, productivity, concentration, all of those things. And there are really good measurable results that say, hey, when we get all these things under better control, I'm a more functional human being. All right, so let's get to this slide because everyone kind of wants to know, well, if it's not allergy, what is it? It can be a lot of other things. So infection, right? Could be infection. I've had patients that had no idea they had a sinus infection. They thought it was just allergies, and whap, bam, boom, there it is. Chemical rhinitis, where it's not just allergies or it's not allergies, and it is a reaction to the environment. Unfortunately, my hairdressers are often victim to this. They don't even know how unhappy their nose is, but the chemical exposure, the coloring processes. My patients who have to work with pesticides, lawn treatments, that kind of thing. Gustatory rhinitis. Oh, don't we all know the patient that, or the family member that has to dab their nose at the end or in the middle of every meal? Their nose is just drippy. That's not allergies. That could be a completely different process. I love the gustatory rhinitis because it's like when you get the spicy foods, you're like, ooh, ooh, and then all of a sudden your nose just runs. That's your body's response to spiciness. Vasomotor rhinitis, that's the drippy nose. Rhinitis medicamentosa. So typically patients will know that they have this. So this is the fancy terminology for being addicted to a decongestant spray. It's almost always Afrin, which is typically oxymetazoline, but there are two other ingredients out there called phenylephrine as well as neosynephrine. And overuse of the decongestant can have terrible ramifications. I've had patients that have literally swollen shut, and no matter how much decongestant spray, it just no longer works, and the congestion gets worse and worse and worse. And this obviously needs medical management. Sometimes it needs surgical intervention. Idiopathic rhinitis, I've got inflammation, I got nasal obstruction, and it's not any of the above. That sucks. And then hormonal. My pregnant ladies, some know, some don't. Sometimes pregnancy is delightful and they don't notice, and other patients that are just swollen shut. And again, nice to know there are some homeopathic that are non-medicated that you can safely use during the duration of your pregnancy. And then last but not least, who's looked inside your nose? What's the anatomy like? Do I have a deviated septum? Do I have polyps? Do I have anatomical variations that make it a mess? And no matter what I take, it's not going to make a difference because there's bony anatomy in the wrong direction. And that's where an ENT can really sort of shed light on things that unfortunately the primary care doctors can't see. The allergists don't really have scopes to look. And on top of that, as an ENT, we can really offer not only an explanation, but look at your anatomy and sort of gauge what the behavior of what goes on in the nose. So here's another busy slide, but essentially saying that the nose is one of the many areas that an ENT does, right? Ear, nose, throat. And the nose is a really complicated place. There's a lot of structural dynamic fluctuation in inflammation from tissue swelling, drainage, reactions to things like, the fungal infection that you didn't know you had, those sorts of things. So, and that's where in ENT, we can really help evaluate, be resourceful, and work really hard at getting to the bottom of the problem. From a standpoint of other than that, sometimes looking in the nose and deciphering how that contributes to other problems, voice issues, a cough, other sorts of things. And then sometimes it's just knowing that you went to the ENT and guess what? It's not my nose. Great. It's not your nose. It's not allergies. It's not an infection. Let's start looking other places for sources of your symptoms, your misery, those sorts of things. And it can be super, super helpful. So, key takeaways. Final one. So I hope everyone was able to stay awake for all this information. Allergies. It's a false alarm. Your body shouldn't be making the response, but it does. Symptoms. Everything: ears, nose, throat, lungs, skin, whole body can be involved with this process. Diagnosis, yep, you got to start with the history. I got to get all the details, got to get the story. And then taking a look inside, what's anatomy doing, what things look like that day, and then considering what kind of testing and what further evaluation needs to be done. Treatments, anything from over-the-counter, non-medication to medication to allergy shots. And again, coming into the doctors doesn't mean you're signing up for everything. And I have one patient today, she's like, "Doc, I'm not going to take anything you prescribe. Tell me all the things I can do over the counter. Let me know." Okay, well, let's start with all these things. And then you're going to tell me what does and doesn't work, what things you tried, what things you didn't like. But, having a healthy conversation about what you think you will and will not do. Know that without care, without addressing your nasal obstruction, you might not be feeling as good as you're supposed to. And then an ENT, not treating just allergies, but treating everything in the nose and contributing to at least the upper airway of your body. All right. So with that, I will take your questions.
Yes, and I'll jump in and just reinforce what I mentioned at the top, which is if you've got questions, best thing to do is just type them in the chat, which is should be the bottom of your Zoom screen, or depending on how you have that oriented. And you should see a chat button. If you just click on that, it'll allow you to type in questions, and I'll read those off as they come in, and we'll address whatever questions or concerns you have. So feel free to fire away. I will say, if you aren't familiar with Zoom and haven't used that before, it is pretty easy to do. You just got to find that chat button. So, okay, so it looks like the questions are starting to roll in. So let me pick this one off first here. Let's see. Let me scroll down. Bear with me for a second. This is from Steve and Angie. Can you have swollen glands / lymph nodes with allergies for a very long time?
Thank you. Thank you for that question. All right. Yeah, I probably should have included a slide of that. So when it comes to symptoms and the lymph nodes, so we'll talk about like lymph nodes, right? Like it's this area right in front of that really important muscle that will turn your head. And there is a lymphatic chain. So these are the clusters of lymph nodes that all go up and down. And they typically will swell when there's a reaction. And, we'll see them most commonly with a sinus infection or a dental infection or even a upper head infection. And it will typically be the side that is infected. Now with allergies, it's almost like a diffuse, especially if it's nasal symptom, you can get a lot of fullness. And it's usually soft but full. It's not usually like a hard, firm mass that you're like, oh, that really, like it shouldn't be tender, 2 or 3 centimeters and fixate. Like that to me that's not allergies. You need to go see a doctor. We need to get that evaluated. But this sort of diffuse fullness, I almost feel like it makes my sort of throat swollen. Yes, that is very common with allergies, but we'll also see that with sinus infections. We'll see that with just sort of upper respiratory yuckiness. And again, what it's doing is it's just processing. Your body is just sort of processing whatever's going on in here and draining it back into your lymphatic system, which the chain goes down to almost the area behind the heart. So, but that's a really good question. Thank you for that.
Right. Here's another one from Richard. Is there a connection between snoring and allergies?
Oh, absolutely. So, and I'll see this more often in the adults than the kids. And there's probably a few layers when it comes to snoring. And the most obvious one that's associated with allergies is congestion. And it's one thing to be stuffy when you're sitting up and then you lay down. Like if you're stuffy sitting up, you know that when you're going to lay down at night, it's going to still be stuffy. The other part of it's okay. I had a bad reaction earlier today. Now I'm stuffy, but it's better. And then I lay down at night and oh my gosh. And part of it is because the anatomy gets into that swollen, congested standpoint. And sometimes if there's mucus, oh, and that's sitting around the back of the nose, you'll be snoring. Sometimes the lymphatic swelling can also affect the base of tongue. It can also sometimes affect reflux, stomach acid, that kind of thing, which can also contribute to snoring. So I will say that if your snoring is a symptom that is significant during like the fall or spring, it could very well be directly correlated to a seasonal allergy. But sometimes without having taken a look, you don't know anatomically, do I have a deviated septum plus allergies? Do I have this plus this? You know, those sorts of things. But snoring can definitely be correlated with allergies and nasal obstruction. Absolutely.
Right. Here's another question. Starts off with a hi doc, thanks for the presentation. I was wondering whether montelukast is safe to use. One, I hope I'm pronouncing that right.
Yeah.
One allergist suggested to use it, while another one asked not to.
Yeah. Montelukast. So it's the generic name for singular. And so it's considered, here's your fancy word of the hour, anti-leukotriene. And what it does is that it blocks a receptor that can be part of the inflammatory cycle with allergies. It's really a more prominent receptor in the lungs. And so we'll see that a lot more often with patients who have asthma or something called reactive airway disease, but they make a lot more mucus in the lungs. And we understand montelukast to help block that receptor to make unnecessary mucus. I would say that we used to probably prescribe it a lot more. And then we started noticing a nasty side effect with pediatric patients having night terrors. Nobody wants their child to be waking up screaming and crying and those sorts of things. I don't see that same side effect frequency in the adults, but I think we're all a little bit more cautious with prescribing it. Obviously, the side effects are typically only while you're taking it. But from a standpoint of, I think it was probably more of a popular thing in the past, but I think it's very particular to your symptoms and what has and has not worked. I would say that, you know, when I look at all the literature and the conferences I've gone to, montelukast is like way down on the list of options to use. But again, it's very personalized. It's a very personal discussion between patient and doctor, because I wouldn't say that there's like an algorithm that says, okay, this is where you insert montelukast. But good question.
Sherry asks for a sort of ballpark estimate of what the blood test and the sublingual drops might cost.
Oh, yikes. So sublingual drops, it looks like, and again, we as a practice have not ventured into this quite yet. So wink, wink, nod, nod. We're hoping to do this in the near future. It will very much depend on what you're allergic to and what we need to do. So no doubt that right now we know that sublingual therapy for cat allergies is probably going to be the most costly of the sublingual options. And I don't necessarily know, apparently that's a price that fluctuates every quarter is what I've been told. So that would definitely be something that we would need to factor in. Now with the sublingual tablets for dust, ragweed, and grass, ragweed, and dust, that's a set price. And most of the time, insurance will provide some coverage, but no doubt that that would be something that we would need to qualify, test, and then sort of establish, and then, of course, cost evaluate. And one thing about some of these allergens is we can design the treatment for what you have. And I don't want to go into too much crazy detail, but I've got a few patients who they've seen the allergist. They know they're allergic to 3 or 4 different things, but it's really ragweed that bothers them the most. And we had a really good conversation about the rest of the year. They've had good management with just the allergy pill, the nasal steroid spray, but ragweed is just terrible. And so, despite the fact that they have mild tree allergies and dust allergies, that we put them on the sublingual ragweed tablet. And because we've been able to manage their worst season, they're better for the rest of the year. So it was a very targeted therapy. We got the treatment and we got them better to the way that they wanted to be. So again, it can be very individualized when it comes to some of these things. And I'm sorry, what was the other part? The sublingual and
Oh,
what's the other part?
about the blood test
Oh,
itself.
blood testing. Okay. So I actually looked up on Quest because a lot of us are high deductible and we have to pay the first however many thousands of dollars of our medical care. A lot of the allergy testing blood work can be between $300 and $500. And there's typically a panel for seasonal that I think is $300 to $400. And then there's another panel that's for the perennial or the year round one. So we talk about dust, cockroach, mouse, but it's not like you can pick and choose what it's a blood panel test. It's set. So I know that for right now, that's probably the only cost reference I have from a standpoint of just allergy testing. But apparently you can go on to Quest and special order your own test, which is fascinating to me. But anyway, so there you go. Healthcare access that's more meaningful to all of us.
There you go. This one's from Joe. He says, I know you mentioned you wouldn't get into the GI effects. If we have time, can you drop a couple of quote unquote bombs about how inflammatory diseases affect allergies, or could histamine reactions cause allergies and diseases like diabetes, ulcerative colitis, Crohn's, etc.?
So I will tell you that I've not seen it cause diabetes. I have not seen it directly correlate with Crohn's or ulcerative colitis, but I will say that on a whole, and again, I am not a GI specialist, and I have been delightfully blessed to have some colleagues that will do both allergies and GI. I've got other colleagues that have done a lot more allergies over the year, but are ENTs. And what we will notice is that there are some inflammatory processes that we can kind of correlate directly with allergies. And a lot of things that we're looking at patients going, you've got a lot of inflammation. Maybe this is contributing to irritable bowel syndrome or, some of the other GI tract irritability. I think one of the things that I think we should all be aware of are some of the crossover. And I would say, like, this is the one that I love to share. So ragweed allergies. If you know you're allergic to ragweed, there is a crossover between ragweed and some foods: cantaloupe, watermelon, and honeydew. There's a protein that is shared between ragweed and those 3 melons that if you're susceptible to ragweed allergies and you decide to eat watermelon, cantaloupe, or honeydew during ragweed allergy season, that you might be greeted with a lot more reflux, indigestion, or just queasiness and nausea. And there's an actual reason for it. I don't know of any other obvious cross reactivity, but as we continue to go further and further into testing and understanding the what we call epitopes, that's really the main factor in the allergen that causes all of this sort of reaction, is that there's a lot of characterizations that we will see with that. So again, this is why it's so important to have a good history. This is so important why we investigate. And even if you don't get the answers on the first visit, or we don't get all the details, that some things will come to surface and come to light as we continue to move forward with how to get you better. But yeah, I always laugh when I was like, oh, we used to think the nose was separate from the lungs, which was separate from the stomach. Right. It's all intertwined. So there you go.
Right. Excellent. Thank you. So here's one. Can an extremely itchy throat and ears be allergies?
It can be. It can be. It would be a little unusual not to have a little bit of drainage and stuffiness. Usually that's part of it. If it's just an itchy, scratchy throat and ears, it could be just reflux. Again, the itchy always makes you think of histamines, which is, again, a direct correlation with allergies or a reaction. So it's a little more diffuse. But I will tell you that if you come in with that symptom and you have the physical exam finding, boom, we're starting to put a story together. We can start thinking about, all right, what do we need to do?
Right. Here's one from Diane. I think she's just clarifying the blood test. Is that called an IgE panel?
So IgE is one of the parts of the panel. IgE is the immunoglobulin. So it's the protein marker that's floating around in the blood. And if it's elevated, you might be in an allergy reaction. But it's sort of a standard part of the blood panel.
Okay.
But usually in that blood panel, there's also like other things that they're testing for.
Great. This one's from Sharon. I had an IgE, speaking of IgE, I had an IgE blood test this spring. Everything is negative. The problem is with swollen, itchy eyes, dry eye. Been working with two eye doctors for a couple of years, retina and regular, and a dermatologist. Constant bags under eyes, constant postnasal stuffiness, postnasal and stuffiness. Think I need to come in and see you and check the nose. Just
Yeah.
this month, ears are clogged as well.
Yeah. I it there is always a concern that this is a crossover with autoimmune, especially when it comes to dry eyes. But if you've not had your nasal exam looked at, it's worthwhile to have that looked at. And then also to take a look at the other symptoms. I mean, your eyes might be the driving factor of your misery, but there may be other associated symptoms or exam findings that need to be further, sort of developed or investigated or looked at. But yeah, I'm so sorry. Dry eyes and irritated eyes are the worst. You can only hide them behind sunglasses and glasses.
Yeah, exactly. Here's one from Richard. When's the best time to take medication like Zyrtec or Flonase?
Okay, so Zyrtec, cetirizine, really good. Oh, really good allergy medication. It can be a little sedating, and because of how it works. So I would typically recommend patients to take cetirizine or Zyrtec at night. I would be very hesitant to say, oh, yeah, you can take the Zyrtec D formulation at night because the D, which is the decongestant, which is the pseudoephedrine, can cause some irritability and make you sleep less effectively. So if you're doing the Zyrtec D, I would take that in the morning. Now, with Claritin, which is also known as loratadine, you can take that any time of day. It doesn't seem to cause quite as much fatigue. Now, I have had some patients that will tell me, it makes me tired too. And then what I'll tell them is, all right, well, then take that one at night as well. But that one doesn't seem to be quite as permeable through what we call the blood-brain barrier. Now, fluticasone, Flonase, definitely the most standard, most easily prescribed and covered nasal steroid spray out there. And I would say that the nasal steroid spray, it's all about compliance. You got to take it on a daily basis. And it takes about a week of everyday use to be therapeutic. My patients with really bad stuffiness, it may take 3 weeks of everyday use before you feel an actual improvement. And the fluticasone Flonase, it's because of a compliance thing. I don't really care when you do it. If you remember to take something every night when you brush your teeth, great, do it then. If it's in the morning, because that's part of your morning routine, then just make sure that when you wake up, that you've blown your nose. It doesn't feel too stuffy or sticky because you want the medicine to go in. You don't want to go in it for it to run back out. So using it in the morning, but it really is a compliance thing every day so that you really get the response that you want because it's a slow and steady intervention, but it is one of the most effective interventions. It's better than the allergy pill for the nose symptoms.
Right. Looks like we have a couple more. Have you heard of DHIST for allergies? What is it and how does it work?
DHIST. I'm not familiar with that. And it may be just the fact that it's probably one of those combination homeopathic things. There are several, like I always look at some of these homeopathic things, and we definitely saw elderberry come around that's supposed to help the immune system. I definitely have heard of some patients using essential oils, but I don't know DHIST specifically. If it's something that helps you and it doesn't have, it's not a spray, so you don't want to be using things like menthol or other peppermint, spearmint, Vicks vapor rub up the nose every day. That's a big no-no. If it is not causing any blood pressure issues, it doesn't have like a decongestant ingredient, usually those things are okay, but I'm not particularly familiar. And I'll put that on my list of things to look at because I'm always interested to see what the latest and greatest is out there.
And this appears to be the last question from Sherry. Do you consider as Elastane the strongest nose spray for allergies, or is there something stronger out there? I don't know if I'm pronouncing that right, but
No, no,
AZ
azelastine. Absolutely. No,
Elastane.
azelastine. Hmm. So it's a nasal antihistamine spray. And I don't know. I would say probably the strongest, safest medication out there is probably Dymista. It's a combination of nasal steroid spray, which is fluticasone, and azelastine. And I would say from a standpoint of strength, I don't necessarily know it's the strongest, but it covers the largest surface area of where the inflammation in the nose comes from. So it'll stop the nerve endings from causing all the drippy drip. It'll tell the mast cells, the basophils, it'll tell all the inflammatory cellular process to chill out as well. And the Dymista, because it's a combination, a lot of my insurances aren't covering it. Although I had a few patients come in this past month where it's being covered again. So it's a reasonable option. Because I've met personally so much resistance with it, I will typically prescribe them separately. Azelastine is a good medication. It has a bitter taste. And so I think for compliance standpoint, I've had some patients who are like, I don't like it every day, but how it works and that kind of thing. But it's a good spray. It's a really good spray. So I'm not going to definitely not dismiss it. I will make one little statement with the azelastine though, is that if you do use it twice a day and you're using it as prescribed as 2 sprays each nostril twice a day, it can cause a little fatigue, which is, kind of shocking. Like, how can a nasal spray cause fatigue? But I will see some patients describe that. So I think it's a good tool. I think for the right person, it can be a very good fit. But from a standpoint, the strongest, I think it really depends on what your symptoms are, how bad they are, and what we're looking to treat. So it's a very good question.
Right, a couple more here.
Uh-oh.
And actually, Sharon, who asked the question about DHIST,
Yeah.
she said it looks like a supplement. She provided a link to it, a page about it.
Okay.
DHIST is an anti-inflammatory supplement containing various antioxidants, enzymes, and plant extracts aimed to
Hmm.
reduce your overall histamine load.
Interesting. I'll have to look into it. I definitely am probably not one of those that I can look at and be like, oh yeah, blah 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 blah. But I will definitely look into it. And if she wants to provide an email to you, I can at least give her a sense of yes, thumbs up or thumbs down. But again, without knowing exactly what things look like, your history, all of that, it would be very hard to say, oh yeah, you should definitely continue that versus not. But it's very interesting to see all these new over-the-counter things that I'm seeing come across all our shelves and through the internet, and what they use in Europe versus New Zealand versus here. It's very eye-opening. And some of this stuff is reasonable, and some of it's just like not reasonable and really expensive, which are the worst.
Uh, Here's what I think is the last one from Diane. With known allergies, is mullein, Mullein, leaf, a no-no? I'm not sure if you're familiar with that, but Mullein, leaf.
Leaf. I'll have to look that one up. I probably have some information somewhere in some notebook about it, but I don't know. And again, a lot of these homeopathic things, no doubt, every time I go to my conferences and every time I start trying to talk to, I mean, we as Western medicine trained doctors just did not get the homeopathic 101 course. And I'm not here to dismiss it. I'm just here to let you know that when we don't have really good research to prove what does and doesn't work, it's very hard to give you a true professional opinion. No doubt that what we do know, and the nice thing is a lot of these allergy medications, the Claritin, the nasal steroid sprays, even oral steroids. I mean, we've done a lot of research on a lot of these medications over the last 10, 15, 20 years. And we've got some really solid data to say, hey, nasal steroid spray, it's your number one for this. Nasal steroid spray and the azelastine, it's a really number one for this. And so we have some very good direction. And a lot of these medications are really quite safe. And again, if they're effective and safe, it might be the right fit for you.
Yeah, it looks like Sharon elaborated. She said that mullein leaf is a plant that can be used
Mhm.
as tea, apparently.
Oh, okay. Yeah, I'll take a look. I bet they use it a lot in Europe. I bet you. They do a lot of neat stuff in Europe. I just don't have good data or anything to kind of go on. And I will tell you that, and again, most of my patients that do any of these homeopathic things, they have a true supplier. You do want to look for quality ingredients. You want to look for consistent quality. You don't want the possibly made and made in China. You don't have consistent degree of plant ingredient extract, those sorts of things. So and that's probably one of the reasons that things like allergy shots and sublingual therapy can be so pricey, is that it's a consistency and quality of care that has to be, tested. So, and it takes a lot of money and resources for that kind of thing.
Yeah, it looks like Sharon is validating your assumption. It is, in fact, a European that product, I guess, or
Yeah.
usage.
So,
So,
and I'll definitely take a look. I'm sure it's directed at specific allergens or specific reaction. So I always worry about some of these things if we're doing too much ingestion with some of these things, because I worry about what really penetrates through the stomach lining. Your gut really dissolves and destroys a lot by its acidity. So so again, one of those things just to be sort of aware of.
yeah.
So.
Yeah, it looks like that's it for questions. We got a bunch of folks who are thanking you for the
Oh,
presentation.
thank you.
So,
Thank you so much for joining me. I'm sorry that the sun is down. I will say that we'd be happy to see you. We have wonderful providers here. We have two locations. We're here in the South Towns. We're also in the North Towns. We have four delightful physicians. Dr. Lafferty is more ears than anything, but Dr. Sapol and I, who practice in the South Towns, are more than happy to see you. Dr. Ray Palini, who's in the North Towns, is also wonderfully qualified to do all of this as well. We have delightful mid-level providers. Please don't hesitate to be seen by them. If you're more complicated, they always bring us in or they refer you back to us. So you're always in very capable hands. And from a standpoint, we want to get you better. We want to make you feel better. And one thing we always want to say is, right, go Bills, right? Because when they're doing good, we all feel good.
yeah, exactly. Well, thank you, Doctor, for a great presentation. We're at just past 7:30, so we packed a ton into this hour, which is
Yes.
great.
Oh,
And hopefully, based on the comments, it looks like everybody is feeling like they learned some things and benefited from it. So that's great.
great.
Thanks for everyone for joining us, and again, carving out an hour of your September evening for us. And certainly, as Dr. Natalka said, um, reach out, give us a call, go to the website, Western New York ENT. It's WNYENT.com.
Mhm.
You can make an appointment online. You can give us a call, that kind of thing. So yeah, I think we're good. Appreciate everyone joining us. And if you do, as I said, we'll send a recording of this to everyone tomorrow, so you can do a deeper dive, share it, that sort of thing. And we've got some other seminars coming up, which we'll also have on the website as well. So yeah, I think we are all set for now. Have a great night. And as Dr. Stachiw said, go Bills.
Good night. Thank you,
Thank
everybody.
you. Have a good night.
You too.
Bye-bye.
Thank you.
Take care, guys.
Bye-bye. You
Bye-bye.
too.